Welcome to the Microsurgery Laboratory in the Department of Orthopedic Surgery at Columbia University. I'm Dr. Robert Strauch. This is the second in a series of instructional videotapes on microsurgical technique. In this video, you will learn how to set up the microscope correctly. We will show you proper hand positioning and posture for successful microsurgical technique. And we will review the instruments that we use. I hope you find this videotape useful in your future microsurgical pursuits. Before we begin, it's important to go over the basic working parts of the microscope that you will be using. Every microscope may be different, but there are features common to all microscopes that it is important to know about. This is your basic operating microscope. This model we use in our laboratory, and it is equipped with a camera as well as an external video source for training purposes. But in the operating room, frequently the camera will not be connected. The basic parts of the operating microscope, common to all scopes, are this part, the part that you look through. This has the eyepieces and the objective as well as a cable for the light source. There's a body that controls the intensity of the light source and the up and down motion of the scope, and is a solid piece so that the scope doesn't move and jiggle while you're operating. And there's a foot pedal that's connected to the base usually that controls both the zoom and the focus, and frequently we'll have a little joystick that you can move with your foot to control the XY orientation of the scope to move it in the correct position for fine positioning purposes. Let's look at the biggest part of the microscope first, the body here. You'll notice that there are some cords coming out of the body. One of them goes to the electrical outlet, and it's essential that this be plugged in or the microscope will not work properly. There's usually another part that goes to the foot pedal, and there may be other cords that go to the other pieces of the microscope depending on your own particular scope. Now, assuming the microscope is correctly plugged in, there's usually a separate power button to press, and then there are other controls to turn the light on for the microscope, and usually we'll turn these up to the maximum. There may be 2, 3, or even more knobs for this purpose. One thing that's crucial to know about is where the light source is for your microscope. This may not be important for the training situation, but in the operating room, it is a disaster to blow a light bulb and not have a replacement or not know how to put the replacement in, because the operating room nurses cannot be relied upon to fix the operating room microscope. So let's look at how to do this. Every microscope is a little bit different, but there's usually an area where the light source will be contained. This particular scope has a little drawer, or it may be on top of the scope or on the side. Now, one of the things you might want to do if the bulb blows out is to detach the light source cord and plug it in to the adjacent bulb, which should be working. If the adjacent bulb is blown out, then you're going to need to change the bulb. This is the module. What we do is we remove the bulb, unplug this thing, change the bulb, put it back in place, put this thing back together again, like this, and then just slide it back in the drawer. And then close it up. Now let's go over the components of the microscope head, which is the part that you will actually be looking through during the operating technique. Usually this swings around 360 degrees, and let's take a look at the different components of it. On the top here, in this particular microscope, there's a little button, and many microscopes will have this button, and this is to centralize the XY position of the microscope. When you press this, and this happens to be facing to you, then this will synchronize with the foot pedal, and then when you move the foot pedal, if it's facing you in the correct position, the microscope will shift in fine movements accordingly. Let's look at the objective lens. If we go down here, we see this one happens to say f200. Now what that means is that the focal length of this lens is 200 millimeters. Let's see if we can unscrew the lens here. We can show that this lens will focus at 200 millimeters. Now there are lenses with an f400 and various numbers, and what that means is that if you have an f400, your scope is going to be much further away, twice as far in fact, from the surface. This may be good if you're doing an ENT case, but if you're doing microsurgery on a limb, you want it to be closer so that your arms are not very far away from your working surface. So for this particular microscope and training situation, we're using a 200 millimeter focal length, and these are easily changed by just screwing them back into the microscope, like that. Now the eyepieces are also adjustable frequently. First thing you need to learn is your interpupillary distance. Everybody's is different. Some people have close set eyes and some people have wide set eyes. The way to check that is to put your eyes and look through the microscope so that you see one circle, not two. If you're seeing two, that means that your interpupillary distance is off. And you can check it because there's usually a little number here that shows you what your interpupillary distance is. Once you know what your interpupillary distance is, it's a good idea to write it down, because then when you go to a different microscope, you can probably set it for the same position as a trial. Now the eyepieces are usually also detachable, and these, you will notice, have a little ring to rotate. Now this is so that you can focus and take into account any differences in the refractive properties of your two eyes. If you happen to be 20/20 in each eye, then you would want to set this for a setting of 0. Sometimes there is no 0, there's just a little line with plus and minus, and you can rotate the white line to that after you've screwed it in all the way to make sure it's set at the maximum inset length, and then you put it in the neutral position. What you would want to do then is to look through each eye, close one eye at a time, and focus so that it's in the correct focusing position for each eye. Now let's look at the foot pedal controls for the operating microscope. While different models will have different controls, usually there's one pedal to adjust the fine focus and one pedal to adjust the zoom, that is, zoom in and zoom out. Also, scopes will frequently have an XY attachment. This is a joystick that will control the motion of the microscope in millimeters, one way or the other. It's important that this be synchronized with the control on the microscope. When you press the button on the top, this will centralize it, and from then on in, movement of this joystick will cause the scope to move in fine increments. If this is turned the opposite way, when you move the joystick, the microscope will move in exactly the opposite direction from the direction you intended to go. So it's important that this be facing you like this on the floor, and then when you move the joystick, the microscope will move in the appropriate direction. Additionally, our microscope has a foot control with pedals that will control the overall height of the scope in this manner, up or down, for gross focusing purposes, so that you can get within the focal length of our lens, which happens to be 200 millimeters. Other microscopes will have a manual control up and down that you just grab the entire head and move it up and down in order to control the gross focal length. Now the focus control moves the scope up and down a little bit. So when we press it, this goes down and this goes up. Now when you begin to operate or to train, you want the scope to be in the middle of the focusing distance so that you have equal ability to focus up as well as to focus down. In order to do that, there's usually a little dot that will help you in order to get the central portion of that focal length, focusing distance, and you want these two to line up with one another. Usually most scopes will have some kind of a similar dot on the head so that you can focus in this way. Now you're ready to begin doing some actual work. Let's review some basic principles first. Your microscope is correctly positioned with respect to the eyepieces for the interpupillary distance and the individual focusing of each eye. Your assistant should also have positioned his or her eyepieces in the proper manner. The XY diagram is facing you, the person that has the control of the foot pedal, which should be on the floor directly in front of you. There's nothing more annoying in the middle of an operation than to have the foot pedal move all around. And it's important that you know exactly where it is. You can either use a shoe or take your shoe off, and that way you'll have a little better control over the foot pedal. Now, to actually get down to looking through the microscope, first you want to make sure that you zoom in all the way to the highest magnification possible. In this way, when you are focused at the highest magnification, you can zoom out and everything should be in focus. Next, we look through the scope and we either use the up and down control that's on the foot pedal, or if you do not have such a control on your foot pedal, you manually move the scope up and down so that while you are zoomed in at the highest magnification, the field comes into focus. Now, this is focused as best as possible using the gross motor controls. However, you then want to take the foot pedal and use the fine focus in order to further focus this correctly. You'd like to make sure also that you haven't forgotten to put the up and down diagram in the center so that you have the maximum focusing distance possible. Now, once this is set, you are at the proper position with respect to the level of the scope from your working field. You now have to position yourself in such a proper manner. In order to do this, it's imperative to have some kind of an adjustable chair that will move up and down so that you can position the height of your body at the correct level of the scope. In order to do this, you don't want to be too hunched over or too high up in the air. You'd like just to be at the correct level and to be comfortable looking through the scope. You'd like your hands to be comfortably resting on the table. We usually use some padding so that your forearm is not resting on the sharp edge of the table, and your elbows should be comfortably bent. Basically, you want to make yourself as comfortable as possible because you may be doing a long microsurgical procedure, during which time you can become more fatigued if you are not comfortably positioned, to say nothing of developing neck and back strain. An additional point about microsurgical ergonomics that our laboratory director, Yelena Akalina, has come up with is the use of one of these cold hot packs placed in a soft bag, or you can use bags of IV solution or just folded towels to rest your forearms and elbows comfortably, as well as your wrists, so that you are totally comfortably positioned for microsurgical technique. These are the finely crafted instruments that make all this work possible, in addition, of course, to a trained microsurgical professional. Now, you'll notice that these instruments are very small, much smaller than the usual instruments in the operating room. They're very fine. The tips of this jeweler's forceps you can hardly even probably see. You can imagine what would happen if you accidentally dropped these on the floor with the tips facing down. These would be irreparably damaged. So it's very important to take extreme care when handling these instruments that you don't knock the instrument tips into one another or drop them on the floor or carelessly throw them at the scrub nurse hoping that they will catch them, because these are expensive instruments and you like to go through as few as possible. Now, let's review the various instruments that we have to work with for training purposes. These are the instruments we will be using. First, a standard scalpel blade with number 15 blade, and a tissue forceps for dissecting the superficial layers of the laboratory rat model. Also a scissors for dissecting purposes. Next, a clamp applicator for applying the fine vessel micro clamps. Next, a curved needle holder that is used for grasping the needle for suturing purposes. Next to that, we have a sturdy jeweler's forceps, and these are all microsurgery instruments used for dissecting the vessels. Next is a curved jeweler's forceps that can be used as well as for a needle holder. Next is a fine jeweler's forceps, a number 5 for fine picking up of material. This is a vessel dilator with very thin points that are blunt on the tips. This is a dissecting scissors used for tissue dissection. And finally, a pair of adventitious scissors using for cleaning off the adventitia from vessels. Next, we have blue background material. We have single vessel clamps and a double vessel clamp. In order not to lose these clamps, it's helpful to have a clamp tray in order to maintain all of our clamps. Of course, no microsurgery set would be complete without 8/0, 9/0, and 10/0 nylon, the 10/0 being the finest of the nylon sutures. Thank you for watching this videotape, and I hope you found it useful for your microsurgical training. On behalf of the microsurgical staff here at Columbia University, the Department of Orthopedic Surgery, I would like to wish you all the best success in your future microsurgical career.